Hi, everyone. I'm Belinda Lee. I'm here from the Autism Alliance's Autism Speaks. I'm the Health and Wellness Lead, and I'm here today with two of my wonderful coworkers, Elena and Heather. We're going to talk a little bit more about back to school and what it means for individuals who have ASD. So I'm going to start first by allowing these young ladies to introduce themselves. I'm going to start with Elena since she's our newest employee. Go ahead and introduce yourself.
Hi, I'm Elena Onak, and I am the Education Engagement Specialist here at AOM.
Hi, I'm Heather Eckner, and I serve as the statewide director of education for the Autism Alliance.
Awesome. Can you two tell me what you do at AAOM?
Sure. So the Autism Alliance of Michigan was founded with the vision of helping to lead efforts and expand opportunities for individuals with autism to reach their greatest potential. And so our work within the education pillar for the organization, we focus on the education system, policy advocacy, collective impact kind of work, and we're really trying to address root causes of systemic barriers for individuals with autism and other disabilities in our education system in Michigan. So we've got a lot of work ahead of us because there are a lot of areas within the education system where students with disabilities just don't have the same access to opportunities. They aren't receiving the same high quality, robust education, and we're certainly not seeing the kinds of results and outcomes that we would like to see. And so our main aspiration of the education pillar is we want to have access to opportunities and have outcomes on par with non-disabled peers for individuals with autism or other related disabilities. And so that's our guiding star.
Okay. Well, thank you for sharing that with me. So the school year started, and I know that parents and students are really nervous about this starting and transition process. Can you share some information as to how to smooth out that process so it's not as stressful for everybody?
For sure. So anytime there's change or transitions, like you mentioned, that can be anxiety inducing for all of us. So one of the fundamental ways to try to temper some of the anxiety is just to keep as much as possible to home and kind of family and life routines as possible, stay as consistent as possible with the things that you can control, because part of that transition are new environments, new people, new sounds, new smells. So as much as you can sort of have those sort of familiar routines, that can often help ground kids as they might head back into school and be unsure of what they're going to encounter. There's also some resources and accommodations like picture schedules, visual schedules, checklists, or even just steps, right? Like what is your day going to be like today? And then some of those things, if you haven't already communicated with your child's school team, you can reach out and communicate with your child's school team to ask what they put in place to try to make those transitions a little more routine, a little safer. Another quick example off the top of my head would be sometimes some picture stories, right? Of like, this is where things will happen in a school. This is where you'll eat lunch. This is where we go to the media center. Those kinds of things can be kind of calming and grounding for kids. So whatever their individualized needs are, it's about communicating that with the school team, but also within your home life, trying to stick to those routines, which can be hard for all of us. So transitions in general often are hard. I don't know, Elena, if you have anything you wanted to add.
Yeah, I want to ask you in particular, since you started with younger folks,
Yeah.
what you did to help with that transition.
Yes. So in early childhood, one of the things that helped a lot with that transition was we would do home visits. I know that's not
Mhm.
always feasible for all of the centers and for schools, but it was really helpful to meet the children in their homes so they could get to know us in their own environment. And then also, we would also try to schedule a time where they could come into the classroom before class started to really meet us and then get to know that environment and the toys and the, like what the room is going to be like when they come in.
Mhm.
Okay, super. Thank you. All right. So I'm going to ask a question about some of the things in terms of meeting students at where they're at to raise that level of expectation, to provide the support that they need. And I'm going to mention three programs. And if you can explain the difference between the three programs and perhaps how they work together. And the three are IEPs, IHPs, and 504s.
Mm. Welcome to the land of acronyms.
Yep.
Definitely in the education system, particularly with special education for students with disabilities, we have plenty of acronyms, lots of terms. It gets pretty complicated. But absolutely, I can break this down. So the first one you mentioned, an IEP, stands for an Individualized Education Program. I'm going to take a couple steps back and just mention that type of support it comes from federal civil rights law. So there's a federal statute called IDEA, which stands for the Individuals with Disabilities Education Act. And under that act, all public schools have an obligation to provide to eligible students a free, appropriate public education, also known as FAPE. So there's lots of acronyms here, right? So IDEA, schools are required to provide FAPE to eligible students. Well, how do they figure out who's eligible? There's an affirmative mandate called Child Find. So local public schools have an affirmative obligation to locate, identify, and evaluate children, youth suspected of having a disability that would impact their education. So it doesn't have to be known yet. It can be just, we think there's some concerns, we don't want to worry, but we don't want to wait. But schools are supposed to be proactive. They're supposed to have measures in place for that. Once that child find process is started, then there's an evaluation. And out of that comprehensive evaluation that is supposed to look at any and all areas of potential concern and impact on learning, that's when an eligibility determination is made. If a child meets, it's basically three questions. Is this a child with a disability that falls under one of the categories of disability for IDEA? And because of their disability, their learning is impacted and they require what's known as specially designed instruction. If the answer to all three of those questions is yes, then they are found eligible and an individualized education program or an IEP is developed. Within that IEP, you talk about the current levels of performance and academic achievement and functional needs. You look at strengths, you look at weaknesses, but the key of the identification are areas of need. So that IEP is supposed to fundamentally address the core areas of need where the child is impacted in their education, their access to learning by their disability. They're supposed to outline then a series of goals and objectives which align to services and supports to help them improve that access and improve that learning. So an IEP, when implemented, is supposed to result in an educational benefit. So that's the whole kind of trail of connection. And then that's part of an ongoing process, the development of those program plans, the ongoing review of them, the progress monitoring, and you have parents are part of that IEP team, school personnel are part of it. So that's what an IEP is. A 504 plan, I'm going to jump to that one next because they often kind of interchange with each other depending on whether a student is eligible under IDEA or not. So a 504 plan comes from a different federal law. It comes from Section 504 of the Rehabilitation Act, which was passed in 1973. And so that's where Section 504 of that act comes from. And that's a broader access law around accessing the environment of learning. So for an individual with a disability that maybe they have a visual impairment or some other impairment or disability that needs accommodations. So the big distinction between IEP and 504 is whether or not the individual student needs that specially designed instruction. If they don't need specially designed instruction and what they need instead are things like extended time, maybe materials to use at home and the same materials to use at school, certain kinds of audio books, right? So those are accommodations to access the learning environment, but they're not specially designed instruction. And so that's where the distinction lies. And actually, any student that is eligible under IDEA for an IEP has the same protections as what's afforded under 504, Section 504. Another distinction, just kind of fun fact, important to know, is that there are some differences in what procedural safeguards and rights are afforded under each law. And so with IDEA, which is that IEP, that has to have a formal written document in place. It has certain timeline requirements. It has certain prior notification requirements. And parents have what are called procedural safeguards to handle disputes. Under Section 504, technically, there doesn't even have to be by law a written document. However, most districts do have a form, a 504 plan form or template that they will use as a communication tool. And there are some ways to handle disputes with Section 504, but it's not quite laid out as sort of procedurally as it is under IDEA. So those are some important distinctions to know about as families go back into this school year. What the key to all of this is, both federal statutes do provide, or there's an obligation to provide FAPE. There's a FAPE obligation under Section 504, and there's a FAPE obligation under IDEA. So for a parent, if I have any concerns about my child in the school setting connected to suspected disability or known disability, I'm going to request in writing a comprehensive evaluation. That's all the parent has to do, is request the comprehensive evaluation. The process then should unfold in a timely manner, and that determination will be made whether does the student, are they found eligible under IDEA? If not, does a 504 plan meet their needs for accommodations to access the learning environment? So then the third bucket that you talked about was an IHP, an individual health plan. So an individualized health plan is more of a medical kind of connection point communication tool for the schools. So for a child that might have some kind of medical health needs that need to be communicated about, known about in the school setting, and then maybe there might be some procedural aspects or some steps that need to be known, that's when an individualized health plan can be crafted with the school. Again, this is something that there are templates and forms. If you Google them online, a lot of health-based organizations or other kinds of affinity groups will have examples of those online. What you can do is, if you have a child who does have some health-related needs, so they need to have an individualized health plan, and they are eligible under IDEA for an IEP, there is a section in the IEP where you can mention some of these other plans, like behavioral plans, health plans. That portion of the IEP is called supplementary aids and services. And there's kind of a whole list in there of accommodations and other plans. It's good to tie those things. So if you have a child with both an IEP and an IHP, ask that the school team document the IHP in the child's individualized education program. And that just helps you keep that communication loop going. But it is part of that whole mix of, we know kids come into the schools, they have a whole host of needs that they might have. And so we do want to make sure that we offer and provide as comprehensive of supports as possible. So those are some examples of how that can be done.
Okay, and I've got a question. With dental care for someone who is, say, someone who's tooth fed, the concern about their oral health and potentially infection in their mouth and pain, which impacts school care, would an IHP be covering, or could it cover oral health care for such an individual?
I think it could. I think that especially if they have it's a specific health need. And if during the course of a school day, there are related challenges with it or related care, like maybe they have some kind of, I'm not going to use the right terms because I don't know dental things, but sometimes there might be like dental, what do I want to say? Like implants, not implants. What am I trying to think of? It's like braces or other things, but there might be like a retainer or some kind of, something in their mouth, that maybe they need to make sure they handle it a certain way when they take it out to eat, for example, right?
Okay.
And so that's the kind of information that can be included in an individualized health plan as a communication tool, right?
Okay.
Between the student, the family, and the school, to make sure that there's a continuity of kind of that attention and care given.
Okay. And rolling right from that question, what, how do parents best address issues where they're not seeing the care that they would expect for their students? How do they best handle that?
Yeah, communication, 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 communication. And I know I'm a parent of two school age kids who have disabilities, and it takes energy, it takes effort, and some days, the thought of sending that email to their teacher feels like a lot for me to handle in a day, and yet I can't emphasize it enough that families do need to communicate and be in contact with their children's school team, school providers, especially if there are any concerns, or even proactively, right? Like if they know their child has anxiety with transitions, or has some needs that have developed over the summer, or they might have some new health concerns. That proactive communication is so important, as well as communicating anytime there's any concerns. Now, for children who have an individualized education program, that IEP, there's a team, and parents are an equal member of that team alongside school personnel. Parents can request an IEP team meeting at any point in the school year. You don't have to wait to be reached out to or contacted by the school team. Parents can proactively say, hey, you know what? My child's IEP, we developed this last spring. Well, guess what? A lot of things happened for them over the summer. And as we start this new school year, I think it would really be great if we could get together and just talk about some of these updates and just make sure that everything in the plan is still going to be working for them. That's entirely appropriate. And the school team should be able to respond to that. So communication, communication, communication. And the one advocacy tip I can give you with that is, there's kind of a mantra in education advocacy, and they say, if it isn't in writing, it didn't happen. So what that means is sometimes there's, the pickup, drop off, the teacher or a school provider might say something to you, you might kind of have this exchange, but if you don't follow that up with an email, just natural things get lost in the shuffle, people are busy. You just always want to make sure that any verbal conversation, any kind of request, any concern, any agreement is then captured by you, sent to the school team, that IEP team, in an email. Because if it isn't in writing, it didn't happen.
Totally get it. Oral is good, written is best.
Yes.
Okay, so another one to think of for individuals with ASD. Health
Mm-hmm.
issues are obviously a big concern. And as we come into the beginning of a new school year, there's a concern about vaccines. What do you say to parents?
So, of course, we want to go with the CDC guidelines on this. Uh, and, there's at the beginning of the school year, there are so many new germs in the classroom, and there's so much. I mean, like, even as a former teacher, I made sure that every year I got my flu shot. Uh, that way I knew that I was not going to be out for a significant amount of time, impacting the children's learning. And you also don't want your student to have to be out and then play that catch up later on because they were out for something that may have been preventable.
What I would add to that is just a shout out to the AAOM Health and Outreach team that there's been a lot of work that the Autism Alliance of Michigan has done to get sensory support kits out to doctors' offices and various locations where vaccinations have been taking place in the community, to help support those with autism and other related needs to feel more comfortable, to be better understood and accepted in those situations. Because sometimes these visits, like again, any new circumstance, any kind of transition activity can be challenging. So as much as we can get that awareness and understanding out there, patience, have patience with kids and adults even who show up, who, are seeking a vaccination, but maybe they need some sensory supports to be able to make it to where they can get across that finish line with an actual shot. So just shout out again to the AAOM team members who have been really helping within the community to engage with that.
Heather, thank you so much for that one. That is a perfect segue to saying that definitely look at the website because we do have information, as Heather mentioned, on sites that we've specifically set up so that they're sensory friendly, so that it is not traumatic for that young individual to get the medical care that they need. That's just such a wonderful one. Heather, I've got a couple more questions. Heather and Elaine, I've got a couple more questions for you. In terms of sensory sensitivities in relation to schools, what suggestions do you have for parents?
Yeah. So honestly, well, parents know their kids best, right? And so whatever kinds of supports that you might be providing in the home setting, again, communicate. Share what works for you in the home, in the community with your child's school team. Schools, fortunately, for the most part, school teams are becoming more and more aware of sensory sensitivities and having some different environmental accommodations available in classrooms. And yet some classrooms might not be there yet, right? And so if something like the fluorescent lights bothers a child, or there's some background noises, we can talk about ways that there are light covers for fluorescent lights. What about wearing noise canceling headphones? There's a lot of different sensory support accommodation items out there now. So if you're unsure of what your child might need or what is appropriate for a school setting, truly Googling it. There's so many resources online connected to that. And you can kind of look and say, oh, would they maybe be willing to try this at the school? Talk to the IEP team. Even if your child doesn't have an IEP, talk to the school team. Let them know just where your child is at and what they might need. Another advocacy tip that's pretty common is, and really any parent could do this for any child, but a back to school kind of one pager snapshot is kind of a common thing that I see shared as an advocacy tip. And you keep it to that one front facing page, throw a cute picture of your kiddo on there. But then you can talk about just quick snapshots of, what are some of their strengths? What are some of their interests? Because that can help with transitions and getting to know and building rapport, but also what are some of their needs, right? And if you are using sensory supports at home or in the community, what works well? And you don't even have to say anything more than that. You can just say, hey, here's a quick at a glance for my kiddo, knowing that it's really busy at the start of the school year. We just want to make sure it's a great year for everybody, right? Thanks for supporting my child. And then you can come back to that later and be like, did you have any questions about it? My kiddo's telling me that maybe they're coming home with headaches. Can we do something about this? If that's a conversation, you're going to follow that up with an email. So, just kind of applying some of those tips along the way. But that snapshot is another great communication tool. No matter whether your child has a formal plan or not, you can use those.
Yes, oral is good, but written is best.
I love that.
So we're going to wrap up here with Elena. How can you guys get in contact with the Autism Alliance of Michigan?
Sure. So you can go to autismallianceofmichigan.org to our website, or you can call us at 877-463-AAOM.
Awesome. Heather, any last words?
I hope everybody does have a good start back to the school year. They're happy, they're healthy. And if you're interested in education advocacy, the Autism Alliance also has a statewide coalition called the Michigan Parent Advocates and Attorneys Coalition, MIPAC. And you can also find that online at www.mipaac.org. Lots of ways to connect.
Yes, that is the best. Again, we're here to help.
Yep.
Ladies, I'm so glad that we're on the same team trying to make things better for people with ASD. Thank you so much for your time and thank you for joining me for this conversation.
Absolutely. Thank you,
Thank you.
Belinda.